Hi, I'm Dr. Marta Baird, and in this video, I'll be showing maxillary expander case examples. This patient presented with a bilateral posterior crossbite. He received phase 1 treatment with a skeletal expander and braces. On the right, this patient presented with a unilateral crossbite. Notice the lower midline is shifted to the patient's right. She was treated with an expander only. Once the jaw width was corrected, the lower jaw repositioned to the center. Without treatment, this patient would have maintained the chin asymmetry into adulthood. When patients require an expander in addition to tooth movement, I recommend Invisalign clear aligners after their expansion phase. This patient is 8 years old. She has 4 permanent upper and lower incisors and 4 permanent molars. There are 12 primary teeth present. This is considered the mixed dentition because she has a combination of adult and primary teeth. She has a narrow maxilla and a crossbite of one of her front teeth. Based on the x-ray, she will not have room for all of her developing teeth. An expander was the first step for her treatment plan. In addition to correcting the width of the upper jaw, the anterior crossbite improved during the expander phase. This view shows the increase in width after the expander. This will increase the room available for the adult teeth. Following the expander phase, I measure the width of the developing adult teeth. This allows me to create the correct amount of space for the developing teeth during the tooth movement stage with Invisalign. The 12 primary teeth are replaced by adult teeth during the years after phase 1 treatment. This patient was treated with an expander for 6 months, followed by Invisalign for a total time of 17 months. These are her teeth before the expander, after the expander, and at the end of phase 1. Notice that there is excess space in the upper arch. This is by design since the adult teeth are larger than the primary teeth. Space is created to accommodate the size of the developing teeth. This patient will now be seen for observation visits over the coming years, until all of the adult teeth have erupted. There are 12 adult teeth to replace the primary teeth, in addition to 4 permanent second molars. Most patients begin phase 2 at the age of 13 or 14. Here's an example of a patient with a narrow maxilla and an anterior crossbite. This patient was treated with an expander and braces for her phase 1 treatment. When she returned for her phase 2 evaluation, she had mild spacing in the upper arch and mild spacing in the lower arch. She also had slight imperfections in her smile aesthetics. This patient was treated with Invisalign for 15 months for her phase 2 treatment. Notice the improvement in alignment, space closure, and smile aesthetics. This is the patient at the beginning of phase 1 and at the end of phase 1, at the beginning of phase 2 and at the end of phase 2, and at the beginning of phase 1 and at the end of phase 2. This patient has a bilateral posterior crossbite. In order to treat this patient, he needed expansion of his maxilla, as well as to create space for his maxillary lateral incisors. Here he is at the end of his first phase of treatment, with the expanded maxilla and room for the developing teeth. He now has many loose primary teeth that need to exfoliate before he can be evaluated for phase 2. He returned at age 14 for his phase 2 evaluation with some mild spacing in the posterior and mild misalignment in the anterior. This patient was treated with Invisalign clear aligners for his phase 2 treatment. His initial smile and smile at the end of phase 1, his smile at the beginning of phase 2, and his smile at the end of phase 2. Not all patients need a maxillary skeletal expander. Sometimes crowding can be treated without an expander. This patient had crowding of her upper incisors and an anterior crossbite. This anterior crossbite was causing her to have recession on her lower anterior teeth. This traumatic bite can cause that lower recession to increase while the adult teeth erupt. This patient was treated with Invisalign clear aligners, and here is a visualization of the stages of her tooth movement. This patient was treated with Invisalign for 7 months, and she is now ready to wait for her phase 2 treatment. Here is her smile before beginning phase 1 and at the end of phase 1. When reviewing the soft tissue improvement, the end of phase 1, and 6 months later, you can see how her gum tissue has healed in that time. This condition would have actually worsened if she had not been treated during phase 1 to resolve the traumatic occlusion and the anterior crossbite. Thank you for watching this video. For more information on orthodontic treatment, visit BairdOrthodontics.com.